Welcome to Medically Speaking, where we bring you expert insights to help you and your family make confident and informed decisions about health and wellness. Today, we're joined by Dr. Erin Adanino. She's a board-certified pediatrician, Wilmington Health. She's best known for her award-winning work in medical education and collaborative patient care. And today, she's going to help us tackle a timely and often tricky topic, which is kids and technology. So without further ado, let's jump right in and meet Dr. Erin Adanino. Dr. Adanino, in today's technology world, what is the right age to introduce a smartphone device or tablet to a child?
That's a really great question. So there's not an exact age. Many children actually end up getting a cell phone in middle school, but what matters most is their maturity. Can they follow rules, handle screen time, and understand internet safety? I typically recommend starting with a basic phone first and then moving on to a smartphone. There's a helpful phone ready questionnaire by AT&T that can be found on the American Academy of Pediatrics website, and that can help guide parents. And some families are also following the wait until 8th movement, which encourages waiting until the end of 8th grade for a smartphone. All of that's to say, both the child and the family should be ready for phone use.
What are some of the long-term effects that you're seeing with kids and technology?
Yes, and so social media is a big one. That can affect sleep times, attention, and can even be addictive. It's designed to trigger dopamine hits to keep kids scrolling. And in teens especially, it can be almost like a constant popularity contest, which can take a toll on self-esteem.
So how can parents set healthy boundaries when it comes to things like screen time, apps, and devices?
Setting clear and consistent rules is key. So I often recommend that families have a tech plan with things such as no phones at the dinner table, setting time limits on using screens, and also not allowing phones or tablets in the bedroom at nighttime.
Ooh, I like that one. We always have a time before bed, so it's no phones after 8 p.m. So that way it gives them some downtime before bed.
Yes, I think that's perfect.
Are there any applications or parental controls that parents can implement to help manage these boundaries?
Yes, and so a lot of new phones or tablets do have parental controls. And while those are helpful to use, what's really most important is actually having open conversations. So kids should feel comfortable coming to you if they see or experience anything concerning online.
Technology moves so fast, it can be tough for parents to keep up. What advice do you have for families to help keep kids safe online?
Starting with an open conversation is key. So asking your kids what apps they're using, who they're talking to, making sure that privacy settings are turned on, and encouraging them not to share any personal information like their full name, their school, their location, and remind them as well that if they ever have something that's uncomfortable online, to feel free to come and talk to a trusted adult.
I imagine these conversations are a lot easier when they're younger. Do you have any last-minute advice for teenagers who may be more unwilling to share their device with their parents?
Yes, so teenagers can often be tricky because at their part of development, they are allowed some privacy as they're becoming adults. But what I really like to emphasize is that if they start making poor decisions or uninformed decisions while they're growing, that's when parents really need to step in and start helping to guide them.
What about setting screen time limits daily? Is that a good idea?
Yes, I think that's a great idea. Ideally, we should limit kids and teens to less than 2 hours a day of screen time. And there's wonderful apps that now exist that can give timers on how much time your child still has left and can automatically shut off at a certain time.
Well, thank you so much. I know this topic is tricky, but it is on the minds of a lot of parents. So I hope that you found this information insightful as well. Thank you for joining us on Medically Speaking, and we'll see you next time.